Hi, I'm Hallie Coltin. I'm a pediatric neuro-oncologist at the CHU St Justine in Montreal. It's such a pleasure to talk about this project, which was funded by the Brain Tumor Foundation of Canada. The project that was funded is looking at the long-term outcomes of pediatric low-grade glioma survivors in Ontario, which is a molecularly informed population-based approach. I'm very fortunate to work with a number of co-investigators, as well as a parent partner, really across the country, mainly focused at St. Justine and Sick Kids, as well as Stollery Children's in Edmonton. So I've listed the people I'm working with. So Julie Bennett, Cynthia Hodkins, Ori Tabori, Paul Nathan, Jonathan Lotherman, Tara Mikun, Vijay Ramaswamy are all at Sick Kids, and then at St. Justine working with Dr. Sébastien Perrault and Leandre Desjardins, and then Leanna Nobre, who is at the Stollery Children's in Edmonton, and we're also very fortunate to work with Julie Jewett, who's our parent partner. So I'd like to give a bit of background in terms of what are pediatric low-grade gliomas. So they are the most frequent central nervous system tumor diagnosed in childhood, and they represent 40% of all CNS tumors in pediatrics. What's important to know is they can occur anywhere in the brain and the spinal cord. And very often the challenges in treating these tumors is that they occur in areas where it's very difficult to surgically remove the entire tumor due to morbidity in terms of functional outcomes. And what's also important to keep in mind is that the vast majority, over 90% of children and adolescents diagnosed with low-grade gliomas will become long-term survivors. And more we're considering this disease to be that of a chronic disease, with an increased focus being on optimizing and improving their long-term health, because very many of these survivors do face lifelong health and functional challenges, really ranging from any kind of complication, for example, seizures and endocrinopathies. And so really, this project is based on wanting to understand and ultimately help to advance the improvement of survivors' long-term health. So what have we learned about these tumors over time? So we've learned that the molecular biology of these tumors is extremely important, both from understanding how to best treat children and adolescents with these tumors, but also giving us an idea in terms of how these tumors might behave, both from a challenge, from a difficulty in treating, the risk of relapse, but also the risk of transformation from more of a benign tumor to a malignant tumor over time, especially in adulthood. And so this is a figure of the MAP kinase pathway, which is the pathway most often alterated in pediatric low-grade gliomas. We've also learned that treatment approaches have significantly changed over time. Again, keeping in mind that we need to think about the long-term health of these survivors when we're making decisions in the present about treatment. And so historically, many of these patients were treated with radiation, and now we know that that's the most significant contributor to long-term morbidity and mortality. And so there's been a shift to treating these patients, especially as surgical procedures and surgical outcomes have improved over time, really a focus more towards treating with chemotherapy and more targeted agents. And lastly, which is really intrinsic to this project, is that in terms of looking at large population-based or epidemiological studies, it's very, very difficult to incorporate tumor molecular data with these large-scale population-based projects. And so the reason for that is that granular, detailed molecular tumor data is very often not included in cancer registries, which are used to link with other population-based health administrative databases. And so on the right, you can see regarding to health services research, every time that a patient interacts with the healthcare system, data are produced, not initially with the intention of research, but we can recycle these data to understand patient outcomes, as well as implications for the healthcare system at large. And so really what this study is helping to do is to bridge the gap between granular tumor molecular data and big data epidemiological studies. And so what are we doing in this project? So first, what we're doing is we're identifying all children and adolescents diagnosed with low-grade gliomas in Ontario over a long time period between 1985 and 2018. And we're doing this through POGONUS, which is Ontario's population-based pediatric oncology cancer registry, which prospectively collects data. And so what's novel about this work is that we're taking tumor molecular data from Ori Tabori and Cynthia Hawkins' labs at SickKids, and we're first working to incorporate that molecular data within POGONUS to be able to include it as an exposure or an important predictor for late effects. We're then through ICS, we're identifying for every survivor up to 5 match controls in the population, and we're following these survivors and their controls up until 2023. And so you can imagine for patients diagnosed in the 80s, this is a significant follow-up time. And then we're calculating the risk of developing the following outcomes. And so we're looking at a wide range of outcomes, including all-cause mortality, acute care hospitalizations, which can be a proxy for poorly controlled chronic conditions, strokes, seizures, severe hearing loss, looking at live birth among female survivors and controls, mental health challenges, endocrine dysfunction, disability, and subsequent malignant neoplasms. And the hope is that this study, for the first time, is going to help us answer a few really very, very important questions. The first question being, is there an association between low-grade glioma tumor biology and the risk of developing significant health complications? And secondly, to allow us to understand what is the current health status of low-grade glioma survivors, of pediatric low-grade glioma survivors, and what's the burden of health complications in these survivors. And so this is really going to be the largest population-based study with a wide range of outcomes over a very long follow-up period, which is extremely exciting. And so where are we at now? So the current stage that we're at is incorporating the molecular data from SickKids into POGONUS. This is a large cohort with many variables, and so it takes time in order to ensure data quality. And so this is where we're at now. However, in the following year, we're going to be linking the data sets at ICS, conducting the analyses, and beginning our knowledge translation work, including disseminating the results from the study. And so I want to take a moment to thank the Brain Tumor Foundation of Canada for funding this important work, and very importantly, to thank our patients and their families for inspiring us, motivating us to do better, and really being the incentive for doing this work. Thank you very much, and I'm very happy to be contacted to discuss. Thank you very much.